Hi, and welcome back to the Total Knee Replacement Support Group YouTube channel. My name is Tony Maritato. I'm a licensed physical therapist, and in today's video, right next to me, you can see a list of 6 of the most common complications following total knee replacement surgery. I want to run through this list of 6, and then I want to talk about each one just a little bit. So first on the list, absolutely, is infection. Risk of infection. The most important thing here is follow your surgical guidelines. Your surgeon will do everything possible to keep you clear of an infection. Once you get home, you're kind of on your own. Now, there are therapists who will come out to the home either as an inpatient Part A service or an outpatient service. You can also contact therapists through a telehealth platform. If you want more information on that, just let me know. But basically, what I would be doing is monitoring the incision. If it's a covered incision with a dressing, usually a waterproof dressing, you want to look for signs of seepage. You want to look for signs of excessive drainage, any smell, any excessive pain, excessive redness. These are all things to be aware of and make your surgical team aware of as well. But keeping an eye on that infection risk is number one priority when you get home. Next, we're looking at long-term knee stiffness. This is probably one of the second most common complaints following surgery. Certainly, there's the normal post-surgical stiffness. The first 3 weeks, 6 weeks, 12 weeks is completely reasonable to feel stiffness through the knee. You've probably seen some of my other videos where I talk about milestones. 6 weeks, we're looking at least 90 degrees of flexion. Sometimes it's achieved at 4 weeks or even sooner. But if we find that you're struggling to gain more than 90 degrees, we're going to look at why that's happening. Is it purely stiffness associated with scar tissue formation? Is it associated with poor pain control? I find in my clinic that most of the time when somebody is dealing with a stiff knee, it's not necessarily the scar tissue, but rather poor pain control that's preventing the knee to move into flexion and extension. So talk to your therapist about knee stiffness, but understand that there's normal stiffness within the first 4, 6 to 12 week time frame. But if your stiffness is persisting, I've got a whole bunch of videos talking about manipulation under anesthesia, compression, and other ways to resolve some of the stiffness associated with a knee replacement surgery. Persistent knee pain. This is probably the most frustrating on the list. For many patients, about 20 to 25%, they deal with persistent pain even well after the recovery has been completed. Pain can be generated by a lot of things. Pain can come from tissue damage, but pain can also come from the central nervous system. Pain can be associated with tissue that wasn't involved with the knee replacement, but has been affected by the knee replacement surgery. Pain could be generated by new alignment of the hip and the ankle. There are lots of things that contribute to pain, and the best way to help you understand what might be the drivers of your pain is to connect with somebody, either a physical therapist or some other professional who can talk you through and look at the different things that might be contributing to the pain that you're experiencing. Certainly even like the circulatory system disruption, nerve pain, the lymphatic system has been changed. So pain is a highly complex experience that humans are living with. We need to understand it as closely as we can, but it takes work to understand what's driving the pain. Implant failure. Now, this is probably one of the less common complications following a total knee replacement. I can tell you that I could probably count on one hand how many true implant failures I've seen over my 21 years of practice ownership. But that being said, it is a reality and it's something that we want to monitor. And so your therapist, your surgeon will be keeping an eye out for this. Sometimes the bone just doesn't grow in the way we expect it to. Sometimes there's default problems in the hardware itself. There are several kinds of implant failure that can happen. We just want a second pair of eyes kind of keeping an eye on the situation. Nerve and blood vessel damage. Very common. I was just talking to an individual who had drop foot following her total knee replacement. She was working hard to try and regain function of the foot and ankle, but As you can imagine, the knee replacement surgery itself is an aggressive surgery. It's a major surgery. They're cutting through lots of tissues. They're manipulating and moving things that aren't necessarily designed to be cut open and then sewn back together. So keeping an eye out for nerve-related symptoms. Sometimes the sooner you can catch something like this, sometimes the easier it is to resolve. There is a common situation where you might feel patches of numbness around the inside area of the knee, numbness around the lateral superior aspect of the knee are two common areas. But within that, the main thing we're looking for related to nerve damage would be loss of function. You're not able to move certain toes. You're not able to flex and extend the ankle. And when we're looking at damage to the blood vessels, we're looking at excessive swelling, excessive discoloration, fluid accumulation in areas that we're not expecting or would not normally be associated with the knee replacement surgery. Blood clots, more common of an issue. This is something that every therapist I've ever met is always keeping an eye out for. There's a collective group of signs and symptoms we watch out for. Certainly excessive or, uncharacteristic swelling, increased redness and heat. If you were to squeeze the calf muscle, excessive pain with that are a couple of what we call the Holman signs. If you go online or look at other resources, you'll find the official citations for assessing whether somebody might have a blood clot. But at the end of the day, you want to get a Doppler, you want to get into the hospital, the emergency room, and get it checked out. In my experience, 21 years of history, I have sent several patients from my clinic directly to the emergency room, and it turned out that they did have a blood clot. So that is where you need a professional set of eyes keeping an eye on the lower extremity. Now, just because there is a blood clot doesn't mean that there is going to be a intervention that the hospital is going to do. Sometimes they change your medication. Sometimes they sit and wait, monitor the situation, but you always want to keep an eye on it. Finally, 2 tips that this particular article, and this article comes from healthpartners.com. 2 tips that they want to share. Make preparing for knee surgery a priority. I've got a bunch of videos on the channel that talk about that. Have your support system in place. Know how you're going to get to the appointment and home from the surgical center. Have your little recovery den set up with all of the stuff that you're going to need to make it as enjoyable of an experience as possible. And then, of course, follow your recovery plan. If you don't have a plan, everything becomes more challenging. I don't remember the exact saying, fail to plan, plan to fail, or expect to fail. I don't know. But have a plan in place, have a team behind you, friends, family, whoever it is that you need. And then, of course, my advice, always get out there and find the therapist that you're going to be working with so that you know and can trust there's somebody there for you if you need to call them, if you have a question in the middle of the night. There are a lot of therapists out there, much like myself, where you'll get their cell phone number, you'll have 24/7 access to them. And for now, at least, Medicare Part B does cover telehealth sessions. So with some of my clients, what I'm able to do is see them in person for the first session, then do a remote or telehealth session as a check-in. So maybe when they're getting out of bed the next day, they have a question about the dressing or how to position the leg, they can jump on a telehealth call for 10 minutes with me, and we can make sure that they're comfortable in doing everything that they need to do. It's much more beneficial than having to load up into the car and drive into the clinic just to ask her a question. So, and that is a covered service under the Medicare Benefit Policy Manual. So guys, I hope that information was helpful. I hope that you're gaining value from looking at the other videos on the channel. If you want to take a look at what YouTube thinks you might want to watch, click this thumbnail right here. Otherwise, search the channel because I've pretty much answered all the questions that my patients have had over the last 21 years. Guys, thanks so much. I'll catch you next time.